Welcome back to the Pebble series, differentiating the difficulties with me, Kavitendral. The prime aim of this series is to remember the concept and retrieve the critical time of demand, especially at the orals and as well when solving the MCQs. Today we will see about the syndromes from ENT, surgery, orthopedics, and from pathology, that is Lemel syndrome, Limite syndrome, Larynx syndrome, Lermite syndrome. Before that, if you have not subscribed our channel, do subscribe for more interesting videos like this, and as well press the bell icon so that you receive a daily video notification. Now we have decoded these words. When we see the Lemel syndrome, the spellings in the Lemel syndrome from starting to the end and from the end to the starting point, it is similar. Likewise, one system in our body that has completing from starting to the end similar structures, a tube-like structure, that is the GI tract. So Lemel syndrome is related to some GI pathology. Next, coming to Lemire syndrome. Lemire syndrome has MI. Although Lemire syndrome has MI, even you extend MIE, it sounds somewhere about MI, but it is MIT, like it sounds might. So don't take this to be in MI. So Lemire syndrome has MI. So it is an IPL season. MI is blue color. So therefore, blue we denote for veins. So Lemire syndrome is a vein pathology. Larynx syndrome is associated arterial pathology. To remember it, rich people live a sedentary life and thereby they are more prone for atherosclerotic diseases. So atherosclerosis takes place in artery and thereby Larynx syndrome is an arterial pathology. Next is Lermite syndrome. Lermite syndrome, it is her. So take her. When you're going to meet her, you will be more excited, right? So excitation. The underlying pathology is basically hyperexcitation of the neuron. So Lermite syndrome is hyperexcitation of neuron. We'll see that later. Let us now see all these syndromes in detail. So Lemel syndrome, we have seen that is LEMMEL has repetition of L, E and M, thereby 2. So diverticula. What is diverticula? That is a periampullary duodenal diverticula, which is causing a pancreatico-biliary disease, resulting in cholestatic and cholestatic jaundice and consequences. It is of three types, type 1, type 2, type 3, wherein type 1 is most common and type 1 is where the major duodenal papilla is within the diverticula, whereas type 2 is in the margin and type 3 the papilla is near the diverticula, of which type 1 is most common. Next is Lemire syndrome. As we discussed, Lemire syndrome, it is associated with vein pathology, that is thrombophlebitis of internal jugular vein. It is usually following a course of severe oropharyngeal infection, that is pharyngitis or tonsillitis. On presentation, the patient will have severe neck pain, and it is all because of infection of anaerobes, especially Fusobacterium necrophorum and other bacteria such as bacteroides, Streptococcus and E. cannella. On examination of the patient, we see the tenderness and palpable cord over the sternocleidomastoid muscle anterior margin. This syndrome is also called as the post-anginal septicemia. Next on the list is Larynx syndrome. Larynx syndrome is basically an aortoiliac disease, that is a kind of peripheral arterial disease, wherein the disease syndrome presents with the triad of claudication, that is a pain in the buttock, lower back and hip because of decreased perfusion, there is impotency and as well absence of femoral pulse. This is Larynx syndrome. It is a peripheral arterial disease. Next is Lermite syndrome. Lermite syndrome, as we discussed, there is hyperexcitation of the neurons. Why there is hyperexcitation? Because there is neuronal demyelination. One of the most common demyelinating disorder is multiple sclerosis, which is the underlying pathology most commonly. Other times we can have cervical spondylosis, cervical spinal cord pathologies also. The complaint of the patient will be shock-like sensation, which is radiating from the neck to the upper limb and the back on flexion of the neck. This is all because there is increased sensitivity of demyelinating neuron. Now a quick recap. Lemel syndrome, periampullary diverticula. Lemire syndrome is IgV, thrombophlebitis. Larynx syndrome is peripheral arterial disease, that is at the aortico-iliac junction that presents as a triad of claudication, absent femoral pulse and impotency. Lermite syndrome is demyelination and neuronal hyperexcitation in the neck, when the person is present with shock-like symptom radiating on flexion of the neck. Thank you so much for your patient listening.